Thank you for your interest in this learning module, Promoting Physical Activity in Older Adults. This session has been organized by the National Center for Equitable Care for Elders and will feature a special presentation from Dr. Shannon Holloway. Our center provides a variety of training and technical assistance opportunities to health centers and community-based organizations as they care for the growing population of community-dwelling older adults in the United States. We encourage you to stay connected with us through our website and social media platforms for valuable information related to healthy aging. In this module, we will review the standard guidelines related to physical activity for older adults, as well as considerations for personalized goal setting and modifications based on a patient's unique needs and circumstances. Our guest presenter, Shannon Holloway, will discuss the value of home-based physical activity programs, particularly for health center patients who may have limited access to resources or accessible environments as they age. The numerous benefits of regular physical activity are well known for individuals across the lifespan, but staying active as we age can promote longevity and overall well-being. It is a misconception that some may be too old to begin exercising or moving more. The health improvements related to physical activity can occur at any age. The standard recommendations for physical activity in adults at any age is at least 150 minutes per week of moderate intensity activities, as well as at least 2 days per week of muscle strengthening activities. Other options are available for those who are interested and capable of vigorous intensity activities. While federal guidelines have remained consistent for some time, there have been more recent changes in adjusting the suggested duration of physical activity sessions. Particularly for older adults, it's important to keep in mind that even short bursts of movement can still add up to the weekly quota if done regularly. Additionally, those over the age of 65 or those living with multiple chronic conditions should focus on physical activity that is safe and appropriate for their abilities. Further in this module, we will explore more detailed considerations for individualized approaches to physical activity goals. There are numerous potential barriers to regular physical activity, which many providers and staff may be able to relate to on a personal level, including concerns related to health or limited access to resources. It can be helpful in conversations with older patients to normalize the presence of barriers to both starting and maintaining an exercise routine, and then strategize around needed supports. Goals that feel realistic and achievable will help build levels of self-confidence over time and increase the likelihood that their physical activity behavior becomes a reliable habit. Staff focused on health promotion should be mindful of an older adult's background and personal beliefs around physical activity when exploring this topic with patients. How do stereotypes or media images of older adults impact a patient's own understanding of their health and related behavior? There is often little representation of the middle of the spectrum between very frail or very fit individuals. How do we, as providers and as a culture, frame what it means to age successfully? And how does that translate to an individual's understanding of themselves as their bodies or abilities may change over time? Health messages and programming should strive to link the concept of fitness to the ability to remain independent while remaining mindful of potential challenges faced by older patients. It is important that providers and staff have conversations with older patients about what matters most to them, namely their health values, outcome goals, and healthcare preferences, as well as making collaborative healthcare decisions. When discussing physical activity goals, there may be specific approaches or benefits that specifically resonate with an individual and may contribute to higher rates of participation and adherence. The most valued outcomes from consistent physical activity may be less technical than we think, like staying connected with family or community contacts and maintaining a sense of independence. Prioritizing what matters to older adults is a key component of the age-friendly health systems framework developed by the John A. Hartford Foundation and the Institute for Healthcare Improvement.